Remember to subscribe and hit the bell icon to never miss an update from iMums.
Cold and flu during pregnancy. Hi mommies, how do I manage a cold when I'm pregnant? And it is such a common thing. I, Dr. Anita Chaudhary, will tell you about that. Cold is a viral infection of the upper respiratory tract. It can involve the throat, headache, sneezing, blocked and runny nose, cough, and even mild fever. Colds can be very uncomfortable, but they're not dangerous to you or your baby. Colds get better on their own without any treatment. Antibiotics do not help because they're caused by viruses and not by bacteria. There are things that you can do to treat your symptoms and make you a little comfortable while your body is fighting with the virus. Resting gives your body more energy to fight the infection. Drink lots of fluids. This will help you feel better and your milk supply will not reduce during breastfeeding. Avoid dehydration, which can be very dangerous in pregnancy. You can even have lemon honey water. Avoid exposure to cigarette smoke. You can use saline nasal sprays to clear the mucus from your nose and sinuses. Inhale steam to help clear your nose and sinuses. There are some medicines you need to avoid while you're pregnant or breastfeeding. If you're not sure whether a particular medicine is safe, please ask your doctor. And you should continue to breastfeed your baby if you have cold, because the baby will get some antibodies from your milk and be protected. How do I manage the flu when I'm pregnant? Influenza, also known as flu, is an infection caused by influenza virus. Most people catch the flu if you come in contact with someone carrying the virus within 1 to 3 days. Symptoms of the flu include fever, sore throat, cough, severe tiredness, muscle aches, and loss of appetite. If you're pregnant and think you might have flu, please see your doctor right away. If you're pregnant, especially if you're in your second or third trimester, you're more likely to become seriously unwell with the flu than people who are not pregnant. If your doctor suspects flu, they may take a swab from your nose and throat to confirm the diagnosis. They may also prescribe you an antiviral medicine if it is needed. This medicine is more effective the earlier you take, so please remember to consult your doctor. There are also strategies that can help you relieve your symptoms. Is the flu dangerous during pregnancy? If you're pregnant, the flu can be dangerous for you and for your baby sometimes. If you're pregnant, you're more likely to catch the flu and you're more likely to experience severe symptoms and complications. Even if you're healthy and your pregnancy is normal, catching the flu can sometimes cause life-threatening complications. Now, what are the complications? You might have pneumonia, it could even damage your heart or other organs, premature labor, and stillbirth. Can I get the flu vaccine during pregnancy? A loud yes. The flu vaccine is the best way to protect both you and your baby from catching the flu. The flu vaccine is recommended at any stage of pregnancy or even during planning phase and even breastfeeding. You should get vaccinated against the flu even if you were already vaccinated last year. This is because the flu vaccine is updated every year to give you the maximum protection expected that year. What medicine can I take during pregnancy? You may have conditions that may need some treatments. Some medicines are not safe to use during pregnancy. Please consult your doctor for that. What medicines can I take during pregnancy? During pregnancy, you may have conditions that might need treatment, but some things are not safe during pregnancy. Please talk to your doctor before starting or stopping or changing any prescription or over-the-counter medicines. Your doctor's word is the final word. Here are some common medicines that are normally used. Paracetamol is considered safe at all stages of pregnancy. Ibuprofen and NSAIDs should not be used during pregnancy unless your doctor has prescribed them. Some cough medicines are safe during pregnancy, but not all types. If you're pregnant and feel unwell with cold symptoms, please take your doctor's advice. Saline nasal sprays are safe during pregnancy. oral decongestant medicines such as pseudoephedrine and phenylephrine are not recommended during pregnancy. And there is limited scientific information about many herbal or complementary products that are used during pregnancy, but please remember to ask a qualified person before you start any of these home remedies in which you don't know the composition. What medicines can I take while I'm breastfeeding? Again, you remember that you must ask your doctor and only then take medicines. No over-the-counter medicines are advised at this stage. Decongestant nasal sprays, medicines that relieve a blocked nose with active ingredients like oxymetazoline and xylometazoline can be used while you're breastfeeding because they do not get transferred to the breast milk. So a very important advice from my side is please do not do any self-medication. Flu is very common. It seems very simple, but sometimes there could be complications because you're pregnant or breastfeeding. So the final word is from your doctor. Thank you and namaste.